evening, guys. Welcome to another episode of Self Care Sunday. So, today we're doing an update on COVID-19 vaccines. What we know so far is that they are claiming that it is 94% in preventing severe symptoms. As of right now, we also do not know how long it lasts in your body or if you can still get it and spread it to other people. So, as of right now, I would like to know where everyone stands on whether they have received it and why they took it, and if they haven't received it, why not?
All right. Good evening, everybody. No, I haven't taken the vaccine yet. It's not readily available as of yet in New York City. That wide availability is not there yet. They are doing a lot of frontline workers. They're doing people that are elder age, and then they're going to start expanding it, and it soon should be readily available in other places. Look, at the end of the day, COVID is rampant. It's going crazy right now. We got 4,000 deaths a day. We have over 400,000 people dead. Look, it's a no-brainer. Yes, I will take it. Coronavirus is existed for a while. We had SARS. If you look in COVID, it's SARS. It's somewhere in there. SARS has been around for a very, very long time. If you look at a Lysol bottle, it already shows that it's already existed. So this variant of coronavirus is something that, is going to require a vaccine that I definitely would take. I make a joke all the time. If a doctor gave it to me, in fact, I'll take it from the doctor's hand and put it in my own arm.
No, I haven't taken it. I honestly, I don't know enough about it to criticize or, I don't know. The one thing I'm concerned about is this Bill Gates dude. He's the one I'm concerned about, because I've been looking at some stuff that he's been saying, and he's been visiting countries like Jamaica, African countries, and he went down to Jamaica for some reason, and he had some private meeting with these people. I don't trust that guy, and if he has anything to do with it, I don't know, man. I'm not saying I'm not gonna take it, but I have to see what's going on first, because I really don't trust these people.
Yeah, I understand what Devin is saying, but at the end of the day, this is a humane problem. There's a lot of misinformation out there that we've suffered for the last 4 years. People are spreading the atmosphere with all this misinformation. Like I said, I've talked to many people that have strong feelings and strong opinions. I respect what you're saying at the end of the day, but we have a human problem. This is a world problem. It's not just a New York State problem or a United States problem. This is affecting every single one of our lives, and some people even closer, and their families have been deeply affected by it. So to me, that's the least I could do. People put way worse things in their body. I'm not justifying to put this in your body, but at the end of the day, we have to get back to normalcy. And I don't see no other way, but we'll get back to normalcy regardless of whatever anybody says. And, someone's going to make money off of something somehow. Somebody makes money off of aspirin. Some people make money off of Tylenol. I don't even you don't even know what's in Tylenol. We put it in our bodies, but if they're saying this thing is going to work, I can respect somebody saying they want to wait to see how it is and, how long it lasts. I can respect that. But at the end of the day, yeah, I'll be open-minded to taking it, because I don't see no other way to get back to normalcy when this many people are getting infected and dying.
Yeah, I hear that. It's just that, as I said, I'm not saying I will not do it. It's just that, there's just so many negative. But I hear you, brother. I hear you.
Yes. So I was down here in Trumpville, and I consider myself a New Yorker who sleeps in Florida. And I was following the great governor of New York, Cuomo. And when he allowed teachers in, I think it's 1B, they call it, level B, 1B, or allowed to get the vaccine. And I said, whoa, really? Okay. I'm newly retired, but I'm functional. And I got on my JetBlue flight. By the way, they're cheap as hell. I kind of feel like I'm flying on a private jet when I get on those bad boys. I take the first flight out early morning, and I usually have a pretty much a section to myself. I got off, and when I got there, I know the website was up. I think it was a Sunday evening, and I couldn't get an appointment. Monday was even worse. By the time I got through, they were offering me something in Staten Island and Queens. And then when you check those sites, it was all filled up till middle of February. So, me being who I am, not taking no for an answer, I called around, and someone put me on. And I got a vaccine last Tuesday. Relatively easy. Walked in, they had it all laid out. I can't disclose my location, because I want to keep the person protected. And it was simple. Walked in, they took my insurance, took my information. I had to show ID that I was a teacher or a former teacher, whatever like it. And then got into the office. I asked the lady that was administering the injection if I could record myself. She said, fine. I told her the reason why I wanted to share it so that I can try to settle some folks who are unnerved. If they saw someone who they knew getting it done, maybe it might make them feel a little bit more comfortable. So I was able to have a little video of myself getting the vaccine. It was so fast, so quick. And instantly, I just felt a little bit better. Like I felt like, you know what? I'm on my way to being out in public and not being terrified of everyone around me. I left. I went home, and people, I shared the video on my Facebook page. And then, I said, if you didn't want to talk to me publicly, you can inbox me or call me. And a few folks did. I got one person sent me a video of Farrakhan and Bill Gates and some other person. I'm like, okay. And, they try to come at me. And my response was basically, he said, I think his quote to me was, why are you participating in your own demise? And my response is, my demise has already occurred. I'm just trying to sustain it. And so other folks were like, are you growing body parts? I'm like, no, everything is fine. The only thing was the area, which I think was common with getting a vaccine. The area that the injection was is very, very painful. It was sore for about 24 hours. And then I might have been a little bit fatigued. Not really sure about that one. But other than that, no ill effects. When I left, they gave me the appointment for the second round, which is 28 days later from the day that I got injected. And literally, I feel no different than I did before, other than I feel more comfortable being out, still social distancing, still wearing a mask. And I'm in Florida now, and I will be coming back up for my second dose and have my full armor so that I can feel safe moving forward.
Yeah, I haven't gotten it yet. I do plan on getting it. I'm still waiting for a little bit. My job has offered the Moderna, and the hospital I work for has offered the Pfizer. So I have options, but haven't made a decision as to when I'm going to do it, but I will be doing it. 6 of my 8 team members have gotten it. There's only one that I know of is definitely not going to be getting it. She just doesn't feel comfortable, but 6 of them have already received at least 1 dose. I want to say 4 have gotten both doses. My mother has gotten both doses. She feels completely fine. Like Langley mentioned, the arm soreness is the most thing I've heard. I've gotten some friends that mentioned that they've got fatigue. A couple of them besides the arm soreness, one had a little bit of a fever. But other than that, everybody has been fine. And I mean, from what I've been hearing, it's been pretty much a standard like vaccine reaction with the soreness and the fatigue kind of across the board, kind of similar to like a flu vaccine. I did have one friend get her first dose and then get COVID afterwards. So it's also very important for people to realize 1 dose does not give you immunity. 2 doses don't give you immunity. 2 doses give you 95% protection. That 5% is still a possibility. But yeah, so she said she was extremely sick, and she got really frustrated because she believes her husband had it, and he was refusing to get tested. And obviously he's in the house, even though she got her first dose, she still came down with it. So that was extremely frustrating for her. And now she has to delay getting her second dose because she was just recently positive. So stuff like that, I've seen people talking about, but for the most part, as far as like symptoms and all that, nothing that would make me say I'm not going to get it, but I just still want to wait my time. Maybe another 4 weeks or so. I'll give myself a little bit of time, but I'm definitely going to be in getting one of them. I just don't know which one yet either. I haven't made my mind up if it's Pfizer or Moderna, but I will be getting it.
Okay, so I have a question for you since you are in the medical field. I feel like a lot of people's apprehension about it is it's silly in a way, but it's also makes sense, right? People are looking for something that is more than 94% effective. They also want more assurity because you're also saying that we don't know how long this will last, how long your protection lasts, and if you will need to be revaccinated annually, every 5 months, every 6 months. There's no real long-term study done on this, right? So I feel like that's where a lot of people's apprehension comes into play. Now, with you being in the medical field and with vaccines, that has been created before here and there, how do you feel that ranks with that as far as that not knowing factor?
I don't think, for me personally, it makes much of a difference because I have to get vaccinated for flu every year. Like, I know that every year flu season is going to come around and I have to get vaccinated for flu. I have read some things that have been showing, scientists have been saying that there is some research to say that a year is what they're expecting the vaccine to last for, which, I mean, makes logical sense based on the type of virus that we're dealing with. But for me, that doesn't change anything. Now, if they said it lasted 5 years, even better, but guaranteeing that 1 year or giving me 1 year of safety or 1 year of a safeguard, to me, that's enough to next year go ahead and get it again. And my hope would be that next year with more information behind it and more research behind it and more people having received it, we'll even have a stronger version of the vaccine next year. Because every year the flu shot changes just a little bit based on the strain that we're exposed to. So I feel like getting it every year doesn't actually give me more hesitation. It actually makes me a little bit more positive towards it, because that means that we're going to be having maybe a stronger version every year, as opposed to having to wait for 5 years and not knowing how much degradation occurs over that 5 years, right? So in that 1 year time frame, we've got all these people now that have been vaccinated, and we've seen how that virus has changed in that 1 year. So the next year, the vaccine can get stronger. And to me, that makes it, it's similar enough to me to what I've been used to seeing that it doesn't make me get more hesitation at all.
What's interesting is the data. The data they're going to be looking at is from a global perspective. Think about that, because it's not just the U.S. We got a global vaccination program. So when I think about that, I think about all the data that's going to be coming out of 2021. That 2022, we'll be able to determine how effective it will be. And another thing, people that are really apprehensive about the vaccine, they're actually apprehensive about wearing a mask. So, like, I don't get it. I'm trying to think, like, you don't want to wear no mask. You don't want to get no vaccine. So how are you going to protect yourself? You're just going to keep spreading it?
Well, to play devil's advocate, right? The reason why they're saying no is exactly what you guys are saying, is that later on there'll be more research and data. So for them, it's like, well, I don't want to be a guinea pig. I don't want to be your test subjects. Even in reality, that's what it is. That is what it is.
That's practical. That's practical thing, and I get it.
But people don't want to know that they're being gypped. They want to be sneakily. If you understand what I'm saying, they don't want to be told in their face like, "We're gonna test you." They want to be like sneakily like, "Oh, okay, I was tested on, I guess." They don't want to know the truth up front.
But at the same token, these are the same people that's getting infected, infecting others. Asymptomatic, walking around in barbershops, no masks, just walking around willy-nilly trying to catch COVID. I don't know. My thing is, like, at the end of the day, like, if we don't do something, like, right? Let's say we did nothing, right? And we just let it keep going on around the circles in our society, killing more people. Every day, evidence is over 4,000 deaths today again, So every day, there's more and more death. I think we're just more immune to it. I think we need more information, more education that should be displayed, more marketing. Like, hey, you can get reinfected. Just because you got COVID, it's not going to last just two months, your immunity, or 4 months. My father works in AFC, and he told me he's seen the same dude come back 3 months later with a reinfection. They're not talking about that. So, that, to me, that's enough to say, hey, I got to do my part to stop this, this virus from going crazy in our communities, and it's affecting us the most. That's what even shocks me the most.
I would hope with this new administration, the level of transparency will be better. And because of that, hopefully people will be more open to hearing the facts instead of having, you know, random stuff spewed and information not given because of lack of knowledge. And now people who actually have the information are open to giving the information because they're no longer going to be, you know, silenced pretty much by people who didn't feel like this was important for us to know as a public. So I'm hoping now that this level of transparency is going to change some of this overarching like denials or, you know, mistrust and all that. So hopefully, fingers crossed, something will come positive out of this change.
Well, you know what's interesting to me is that, especially young folks, well, I'm old, so younger folks who basically they have more risky behavior, and they're making this thing to be so challenging. Like, you know, they'll go get something from the dealer, and they have no background check on that. And here's something where there's actually documented information that's mind-boggling to me. Like, they're going to continue to do that behavior, and here's something that can save lives, and they don't see it as a potential good thing to do. So again, over time, minds, you know, it takes a long time to change someone's mind about something. So let's see what happens. Let's hope for the best.
Just historically, just to piggyback off of that, the Spanish flu lasted for 2 years, and that's with discipline. I looked at some boring historical video. I watch a lot of boring stuff sometimes, and I looked at the history of it for 2 years. It lasted for 2 years, and it was worse than what was going on right now. It spread like wildfire. I think it killed millions, right? And it attacked young people. It didn't attack older people first. It attacked young people. Young people were dying. Older people weren't. And with that discipline, it lasted 2 years. The discipline that we have, look, we don't even wait to buy things no more. We just like throw it on the credit card, you know? So there's no discipline no more. So easily, this thing can last. Without a vaccine, this can last for like 5 years. So in my opinion, I think that, you know, hopefully it slows it down. Hopefully it disappears from society, which we don't know if it will or not, because the Spanish flu did disappear. It didn't come back. It just, you know, something else happened, you know? Like we have regular flus now. And hopefully the punch of it will just dissipate, you know? COVID event, you know, over time we'll be like, hey, you know, Tashana, I had COVID 3 days ago, you know, and I'm over it. Like, it'll be like a conversation like that. Hopefully it gets to that point.
Hopefully. Omar, what about you?
Actually, the nurse that gave me my COVID test today, she took it. I was very inquisitive. I was asking a lot of questions. So one of the things she stated, Sharice, is it? She stated that she had arm soreness, she was fatigued, and she had a slight fever. And I'm like, okay, anything else? You know, did you have like a third head growing inside your head or something like that? But she proceeded to say that you take it at your own discretion, because she did mention something that was quite alarming. She said that there were some nurses who were really apprehensive about taking it. And I was just curious. I was just like, so why? Because they also felt that there wasn't enough information, and there's also, they didn't feel comfortable taking 2 doses. And I'm along that same comfort, just don't feel comfortable taking 2 doses where they're such, you know, they're so spread apart from one another. And I still think it's too early, although the last time we gathered, I was on like the other side saying, hell nah, I ain't doing it. But given the fact that COVID kind of hit closer to home this time around, where my son was exposed to it, it kind of changed the complexity a little bit when children are involved, right? So it's just a matter of, you know, keeping that safe, right? So I just need to know more or less the effects, because when she also mentioned their side effects, and they vary through, obviously through different people, depends upon your whole immune system, whatever the case is. So that's a whole nother issue. And then she proceeded to say, well, you know, it doesn't help that we have another strand of the COVID coming along. And I'm like, what the hell, lady? You're supposed to get me into taking the vaccine, not, you know. But it's along the lines of what everyone is saying. We need to educate ourselves. That's something I'm big on. So to answer your question in one simple word, no, did not take it, Tashana. But I am, to piggyback off Brother Langley, I am more hopeful than I was previously, especially for the preservation of, you know, the kids, because essentially that's what the purpose is for. However, I do think they need to do a better job in keeping us informed. And last thing before I get off my soapbox, the vaccines are not as accessible, and that's become a problem, especially within the Black community, right? My dad has been spending the past 2 weeks trying to get the vaccine, and my parents, they're at that age where they're ailing, right? They have like those background ailments as they get older. So I just think that needs to be a bit more out there for that demographic, because it's kind of like those sneakers that came out, you can't find them anywhere, right? So it's one of those things.
That
Off my
makes sense.
soapbox now.
I think that's what the mayor pretty much announced too, that he wasn't very happy about, especially in New
Yeah,
York
it was
City.
terrible.
Yeah,
The
it's terrible.
distribution.
Yeah,
Like you really are like
you're right on.
scattered in the city
Yeah.
trying to look for it, and it's kind of like, I'm gonna sing you to my boy JoJo. He gonna tell you the spot to go to. It's kind of like one of those things, and it shouldn't be like that.
You know what happened over the last couple of weeks? They said that the Biden administration was so alarmed when they looked at the Trump plan for the vaccine rollout. There was no plan. So for the last couple of weeks, he wasn't doing nothing. We already knew he wasn't doing
Doesn't
nothing.
surprise anybody, really.
Absolutely. He's been missing in action since January 20th, 2017. So, you know,
You
like,
can go further back than that.
oh, yeah. Let's be honest. 2015, he wasn't doing nothing anyway. Anyway, maybe it's better that he wasn't doing anything. But in this situation where it was dire for him to do something, he didn't. So Joe Biden, I think, signed just yesterday the Military Defense Act. I think that's going to allow more rollout of vaccine. It's going to make it more accessible and more testing and stuff like that.
I also think that the Johnson & Johnson vax, when it gets to us, so it's a game changer because it's a one-shot dose. I think a lot of folks will feel more comfortable with that.
I heard about that.
Yeah, people are apprehensive about, their data being tracked, them having to come back for a second dose. So a one-shot dose would be a game changer. Someone gets there, get it done. They don't have to think about it as much if they're, apprehensive to begin with. So
I think
the
it's funny,
change.
though.
Go ahead.
The same thing you just said, Langley, about the one shot, and then Omar had mentioned the two shot being his apprehension. More vaccines than not have multiple doses. So the MMR vaccine we got as a kid is like 3 doses. The Hep B vaccine is like between 2 and 4 doses. And you don't even realize it because obviously you were a kid and it happened. But a lot of times it's required to get the level of immunity that you need to have more than 1 dose. 1 dose is fantastic. They can do it that way, awesome. But it's not actually an uncommon thing to have multiple doses for a vaccination. And as far as the Johnson & Johnson, I haven't heard too much about that one, but I did hear something about AstraZeneca, the other one they're talking about, and that's like a 75% effectiveness. And to me, that doesn't even make sense. Like, I don't even know why you would bring out a vaccine that has 75% effectiveness when you have 2 now that are 94 and 95%. So just as an aside, but yeah, the dosing number to me doesn't really change my apprehension.
My mother-in-law lives on 10470 in the Bronx. They're at 17% right now. They're the highest in New York City in terms of positivity rate. It's been going up steadily every single month. That means people at this point, they really don't give a damn. They're walking outside, no masks, barbershops, no masks. Brooklyn, 15%. This is as of January 1st. Queens, some parts of the Bronx, 104.74, 14%. Hunts Point. My area right here, where I live in Allerton, Pelham Parkway area, 12%. These are the statistics that we're looking at, and it's not going to go down. It's going to keep going up. So there's no real other solutions. If they're not going to wear any masks, we have to, I don't know how much of society has to get vaccinated for this to go down, but what else are we going to do? You know what I mean?
80%, at least 80%.
Yeah.
Which is going to be difficult.
It's going to be very difficult. But you know what they're going to do? I think if we leave the state, you go to another state, you leave the state, you go to another country, they're going to make you take a vaccine. No doubt about it. If you come into the country, you're probably going to have to take a vaccine, if you didn't take it when you left. I think it's going to be something like that.
Pfizer just pretty much announced that they will be doing trial runs for children ages 12 to 16, right? About 2,000 and change have already signed up for that, and that's what they are intending to do. How do you feel about children taking the vaccine?
So I kind of think about it from both perspectives, from the people who from the perspective of someone who would be opposed to the vaccine or opposed to children being exposed to the vaccine, because there's potentially going to be side effects. Many of the side effects still discovered during phase 2 trials, but many of the side effects, as with any vaccine, they discover while it's actually actively in the market, right? So from that regard, you know, I have some hesitation about it, but it's no different than the measles or any other vaccine that we expose children to, you know what I mean? Because the consequence of not doing that is a pandemic of any of these other illnesses that could potentially kill us by the millions, you know what I mean? And so from that regard, you know, though I can see why someone would have pause about it, yeah, I think it's a good idea to have children vaccinated.
I have reservations on that as well. Like every other vaccine, remember as a kid, I don't know if y'all remember, it was chickenpox. I had chickenpox when I was in first grade. And with vaccinations now, I don't think kids can even get chickenpox anymore, you know?
Yeah.
But I think it may be a good thing over time. There's not too many reports about kids getting infected as much as adults. And, you know, because the statistics, like, I think kids can get infected, but it doesn't really, based on the science, I don't think they really infect adults from that. I think it's adults affecting kids. You understand what I'm saying? Because, and let me knock on wood, my kid, 1.5, he's in daycare. And thank God he's never come back with anything that affected us, and he's in daycare. So there's just signs that it's harder for a kid to spread it to an adult. I think we need to learn more research over time about what before we give it to our kids. And then over time, maybe they should get it.
To your point, D, like, I think we need to really be mindful of that too, because when we get to the high school kids, as educators, we know how they give it up after school. Like even now, like watching them, none of them have masks on. I think we really need to, like, if we're gonna have a plan for that, we need to stick to it. Whereas if the kids are to take take the vaccine or whatever the case is, because they do want them to get back into school, parents will want that, or they would ask about that. I know the schools that I've visited and the school that I'm in, like the parents are very much sticklers when it comes to that. They want to make sure that the school has a plan. They want to make sure the teachers are tested. They want the teachers to be tested every week, right? So are we listening to the parents? Because essentially they're the ones also bringing their kids in and exposing them, and they're coming back home, right? And some of these kids live very far. So there's a lot of things that go into this as far as getting kids exposed to such, you know.
That actually happened out here. There was a daycare, and they contact traced back to a kid that was attending this daycare, and it spread out to 900 people. Within 2 weeks, it was 2,000. Wow. So that's really, I think, why legislatively and practically they're putting such a focus on targeting these age groups, is because kids is the whole, school systems are the engine that makes our economy run, right? Because if a parent has to be at home with their child, or if a parent has to take that extra time because they're not getting that face-to-face with their teacher, that's putting a hindrance on productivity for that business that parent is working at. You know what I mean? And so that's the whole shebang. That's why they're super focused on making sure that kids can get back into being in school 100% of the time. And that's probably why there's such an emphasis on making sure that children specifically get vaccinated.
I'm not against taking it. I just don't trust the people that's giving it. I mean, you gotta, if you look at history, I'm sure you guys are up to date and stuff like that. The US government have a history of screwing people over and stuff like that. There's a lot of evidence on that. And I don't know if anybody ever seen those lectures with the Bill Gates dude. I'm saying, doesn't that bring any concern? I mean, remember, people that looks like me and you, we're not, you know, the people that's running the country, we're not exactly the people they have choice for them. So I don't know, man. Maybe I'm paranoid, but I don't trust the people, man. I just don't.
Look at the end of the day. This is not a United States problem. This is a global problem.
I know.
You know, it's killing people all over the place. And you're right. I know the history of our dirty past, and and regarding, you know, vaccinations against us. I read a lot of books about this stuff, and I get it. There's a lot of misinformation in the atmosphere right now. There's a reason why some rich people are willing to pay for a vaccine to get ahead of the line to get a vaccination in Florida somewhere. Why are they paying so they can rush against the line and get something, you know, vaccinations in Florida? This is to you know, give themselves immunity against this thing, because they already know this thing probably works to some degree. There's not that many choices. Look, if society was disciplined enough, we all put masks on together and get through this, we can get through it. But society is not disciplined. It's just not. America hates to be told what to do. No, you know what I'm talking about. People hate to be told what to do. And look what's happening.
And you're right, because I'm out in Wisconsin a lot, and those people, they don't wear masks.
Forget it. They're not going to.
They don't.
They're gonna affect the whole family. They don't care.
That brings up a good point. There was an article that came out this morning about how I don't know if you guys know the history about Palestine. I won't really explain it in depth, but Palestine is being occupied by Israel. Israel was established after World War II and has basically been, through the aid of the United Nations and America, has been a militant state that's oppressed the Palestinian people, right? And so since they've occupied the Palestinian country, they're responsible for taking care of their people. But the same thing that's happening in Palestine is the same thing that's happening in Africa. Africa won't have access to the vaccine until 3 to 4 years from now. Palestine won't have access to the vaccine at all. And so these issues that we're talking about, to Devin's point, there is a real history in this country about them using medical research to experiment and test things that they knew would have adverse effects on in the Black community. But to Daryl's point, this is a global economic issue, which is a different type of incentive to fix, you know what I mean, than what they were researching back then. And so the real issues today, as far as race is concerned, in my mind, is the fact that these are first world problems we're discussing. We're discussing whether we want to use the resources that are available to us. But the real oppression that's happening is Black and brown people all around the world don't even have that privilege. You know what I mean?
Normally dealing with high school knuckleheads, I try to break it down for them to make it real simple, okay? So when I hear the Bill Gates argument, my response is, well, Bill Gates, he kind of wants more people around so that he can continue to make money off of us instead of killing us, right? Then they come up with this other thing about the chip. I hear that a lot. I'm like, I'm not that important. Nobody wants to follow me. If they're following me, they already have my internet ID code and all of that. So I'm not that important for anybody who want to follow me, okay? And it's just fear. Fear is a powerful motivator, and it's what the Republican Party does to get people to do things. And it's kind of what we live off as well in our community. But you have to make a judgment between, do I allow my fear to drive me, or do I look at what's actually happening in the moment and make the decision based on my current reality? And it's not an easy thing to do, but you really have to take that leap of faith, so to speak, because they're jumping the line to get the vaccine. So therefore it works. So if they're taking it, then if you're really that nervous about it, you got to say, well, they're trying to stay alive. So maybe this one is not one of those things that's against us per se. So we are in that vortex of our history of the fear, but we have to take into account the current situation. And like you continuously have said on this video, people are dying. That's the reality. So you're juxtaposing people currently dying to what happened in the past and them trying to, put us in a vulnerable situation, which we're already in. The only way out of this thing right now is to follow what they're saying. Stay away from folks 6 feet, wear the mask, and the vaccine is the magic bullet. And
not to get off topic too much, but we're dealing with multiple pandemics. We're dealing with a race pandemic. We're dealing with a disinformation pandemic. We're dealing with the coronavirus pandemic. We're dealing with a lot of things. So I get it. It's psychologically damaging a lot of people. And remember, we have mental health problems now. So it's even exacerbated by what we experienced not only in the last 4 years, but what we're experiencing with, you know, young adults who are entrapped in a house. So I get it. But at the same time, we have to do something. We can't do nothing, you know?
Okay, so how do you guys feel about Super Bowl? 22,000 fans will be there. NFL released their statement saying that
It's
they
in
will,
Florida. It doesn't matter.
right? So
Oh.
they're going to release. Well, they're inviting 7,500 vaccine nurses and medical staff, and they plan to do social distancing. They plan to have the seating pods. They plan to have concession stands without no touch. They plan to pretty much have protocol in place. But how do you guys feel about this Super Bowl event?
Well, this is outside of just the Super Bowl. I just think in sports in general. I think the fact that they have such things accessible to them, it kind of makes the general public look like, yo, what the F? You know what I mean? So I just think the fact that they have 22,000, I think that's a bit egregious and it's a bit much for now. And I think, but that's just the NFL. Lord have mercy. They know how I feel about those guys. But it's exactly money. Money's the bottom line. And the fact that Super Bowl generates so much money around this time, they're not going to miss out on that cash bag. But I think, is it really worth it for what we're going through now? And I have a love-hate with sports right now because I feel like there's more players who are getting COVID, and then, like, you know, who knows what treatment they're getting outside of that for them to come back, right? And it's kind of like when it started, the general public, us, we were like, hey, how is it that Kevin Durant can get access to these COVID tests, but, you know, Darrell can't get it, right? You know what I mean? So exactly, money, but the thing is, without us, right, Kevin Durant wouldn't really be relevant. So I think that to cater to the fans, I don't know, it's just, I think it's not a good idea. 22,000 is a bit.
To the fans caters to the bottom line. At the end of the day, there's always going to be money at the root of all of it. Vaccine is going to help everybody, but also it lines a lot of pockets. So regardless, as much as it's going to help us, it's still going to make a lot of rich people richer. It doesn't always get down to the money regardless. It's a dumb idea to have all those people at the Super Bowl, but for their purposes, it makes them more money. That's why they made the caveat, oh, we're making it to be like, you know, we're getting all the healthcare workers and giving them, it's like a treat for them, but they have to be vaccinated first. Well, then all the other people that are there, they're not vaccinated, then what? Like, it seems very short-sighted in my opinion, but also they're trying to make it seem like they're doing something for the good of the country, and they're trying to show, you know, we're only inviting the healthcare workers and doing something good for them because they've been on the front lines. But it's very short-sighted, and I think it's also very dumb. I just
14,000 is not healthcare workers.
I agree.
Boggled my mind. Say what, Shauna?
14,000 people there will not be healthcare workers, but they have seated pods. I don't know what that is, but they got that. Yay.
Well, being down here in the fall, they played high school football like nothing was going on. Okay. And during that time, I actually went to a couple of games and stayed as far away from a crowd as possible. And trust me, people sat in the stands next to each other. Many of them, I would say, had a mask on, but they were out there as if the world continued, and other than wearing a mask, it didn't exist. So this is the mentality in Florida. So they're fortunate that the Super Bowl was already scheduled for Tampa, and you know, like they're having the NFL experience where you do the, you know, all the rituals of going to those events for the week leading up to the game, and they're doing all the stuff, the social distancing and all of that, but it's still a crowd of people being in a space together. Different world.
And not to mention, I heard the WWE is doing their WrestleMania down there in Florida. So Florida just don't care about the rules at all. They're really just doing whatever they want.
They gonna wipe out the whole freaking state. Like, my friend works in Tampa, and she just got an announcement from her job that said that their hospital is now being overrun, and they're urging the physicians and the providers to discharge patients who are not there for COVID because they need the rooms for all the COVID patients that are coming in. Like, seriously? So now, I might not be that well, but I'm well enough to get kicked out because you got all these COVID patients coming in because nobody is listening. Like Florida is just.
I really wonder in Florida, is it like the purge over there? Like some rich people are behind the scenes and said, let this much amount of people die from COVID. Just let them do what they got to do. Let them infect everybody. No mask.
Arguments that like Florida politicians in particular will make is that their economy is dependent on tourism and events like these. They said the Super Bowl generates like $3.6 billion just in ad revenue, right? And so you think of how many people are employed behind the scenes and executives and small businesses and the little food stands and retailers, and how many people that are employed by that to not have it will be $3.6 billion in people who were distributed amongst however many people that wouldn't exist, right? And so that's the argument that they make for why they need to do it, is that if you take that away, Florida runs a deficit in terms of the money they contribute to the federal budget, right? New York City, California, Texas are states that contribute more to the federal government. Florida is one of those states that kind of depends on revenue from states like New York. So if they're not producing revenue, money, whatever you want to call it, there's a lot of unemployed people. There's a lot of people.
But I get all that, but infecting people and potentially they could be, bringing it home to their family.
I'm not justifying. I'm just saying that's the argument that they make for why they're doing it. On the flip side, that means that you have bad politics. If your economy is dependent on you putting people's lives at risk, then you need to find a better way to do this. You know what I mean?
Exactly. That's what I was about to say. It's not business prudent,
right?
In my opinion. I was agreeing with you. I'm just saying that in Florida, it's not business prudent.
What do you see the projected future of returning to some level of normalcy looking like? How quickly do you see that happening, especially with vaccine being available and hoping with this new administration coming in that, we'll have more transparency as much as availability, especially to the Black and Brown community, which it's really deeply affecting the most. How soon do you see any level and return of normalcy coming in?
Well, with the vaccine being distributed, if it really works, I would say 2 years, everything will be good. If not, I think we're going to be riding for at least 5 years before the whole world get immunity. I hope the vaccine really works. I really do.
Yesterday, Dr. Fauci said, if we're able to get the vaccine to 80% of the population, then we're looking at fall 2022, which is a year and a half from now. So optimistically, a year and a half from now seems very optimistic. And so pretty much I'm on the same line as Devin, which is like, yeah, we might be at 2 years, which it's so frustrating. I want to go somewhere. I'm tired of being in the United States. I want to travel. I want to be able to go outside and just enjoy my life without having to stick a mask on my face. And it's so crazy because now it's become such a normal fabric of what I do that I feel like even when things are normal, I'm probably still going to want to wear a mask and avoid people in crowds because it's almost become like innate. I just get like really tense around groups of people now. It just makes me feel really uneasy. Maybe after the vaccine, I'll feel a little bit less like that. But yeah, 2 years seems like a normal, especially with the way the distribution of the vaccine is going right now, with large pockets of Black and Brown communities, especially which people who are most affected, not really having easy access to it. 2 years seems like a more realistic projection, as much as it pains me to say it.
I'm going to be optimistic. I'm going to say definitely 2022, but I'm going to say January, first quarter of 2022.
Yeah, I just want to say my goal, I don't have a time frame on it, but I'm optimistic as usual. But I just want to be in the middle of a crowd, jumping around.
And twerking.
Whatever. Well, I don't know about twerking, but I want to be at a concert with a bunch of people around me yelling and screaming and enjoying it. That's my social dream for the future.
I hate to be the pessimist.
Come on, Lee.
So what I was reading was if the positivity rate stays at, I think it's 5.5%. I don't know if it's globally or just in certain countries, they're anticipating that this would potentially be an endemic, which would be something similar to what we see with the flu, which means that it would come around seasonally forever, essentially. And to, Sharice's point, I don't got that much faith in these people that be walking around thinking that they're Superman or that they're immune to it or whatever they believe, to think that we can get to, 70% vaccination rate? Poll, a group of friends and see how many of them are even interested in considering the vaccine, let alone taking it. You know what I mean? So to think that 70% of the population will get there before the end of this year to be able to reach January or fall of next year, I think what we'll see is declines to the point where we can get back to relatively normal ways of living. But I think it will change the way that we live and the way that we do regular things like getting on a plane or traveling for vacation or going to sporting events. I think that we'll continue to see certain restrictions and just health considerations going forward, because not just for COVID, but this brings the public to realize the potential for other pandemics that could potentially break out in the same way. So I think that it'll change the way that we do things going forward. But I don't think we'll be at this point that we're in. So I think as far as getting back to relative normalcy, I'm gonna go with the 2-year mark, yeah, for sure.
Are you gonna get the vaccine?
Next year.
Okay.
I did poll my friends, Lee, and I'm at about 90%. So my slogan is no new friends 2021. I'm good in my circle. I don't need to go nowhere else with nobody. We good.
I think I'm gonna go with Durrell on this one. I think 1.5 years. And the reason being is because I think we have someone in office who has, like you guys have been saying, has an idea of what it is to get the job done. I will say that, like you guys said, have an adult to make the decisions for once, right? I think that plays a huge part, right? But I also feel that, as you guys also stated, it's very important that we really hone in on these Black and brown communities, because again, I work in these areas. You guys know these areas. They're in dire need, right? They're in dire need. And again, I go back to my dad trying to find a place where he can get a vaccine. Like that's, my dad is 73 years old. You know what I'm saying? So it's just a matter of and I know there's countless others who are going through the same thing. So I think if, put that in perspective, but 1.5 years.
I'm actually trying to do an initiative with some local politicians to get more PPE and NYCHA buildings, like these areas where people are like Section 8. I'm trying to work on that, where I can coordinate, where I can get more PPE, because a lot of people don't have PPE. And that's the reason why, probably other reasons why they're not wearing masks.